COVID-19 scams are running rampant in India. A recent article in the New York Times highlights the tactics used against people who are desperately trying to save their loved ones by any means necessary. Kumar is with us now. He's a reporter with the New York Times New Delhi bureau, and he co-wrote the piece. Boy, I mean, when we talk about scams, Hari, we're talking about at every level when it comes to treatment outside of the hospital, treatment in the hospital, even funerals, people are being taken advantage of. But before we get into those scams, I just want you to let us know what the situation is like in India now. We've been covering it throughout sort of the past weeks, but, you know, have things slowed at all? What's the situation, and how are the hospitals doing?
So now the situation has a little bit calmed down. It has slowed a bit. At the peak of it, India was getting 400,000 positive cases per day. But now India is getting little more than 200,000 cases per day. And number of deaths are still taking place. So little less than 4,000 deaths are taking place per day. But it was more than 4,000 taking place earlier. So as far as deaths are concerned, yes, more deaths are taking place. But as far as positive cases are concerned, that has come down to nearly half of at its peak early May. And because the cases have come down, so this kind of other problem, the hospital bed, oxygen, Remdesivir injection, or ambulances, or the burial places at the cremation ground, everything has come down. But at peak of it, it was really very, very humiliating and very frustrating to the family and to the patient. Everything related to the health and death came under tremendous pressure. So people are not getting hospital bed, they were not getting oxygen, they were not getting medicines, they were not getting ventilators. Everything was in dire shortage. Everything related to COVID, everything related to health was in shortage. And then if you die, then everything related to your death was also in shortage. So you were getting, it was a long queue at the cremation spot. It was too much money for the burial goods, etc. So that was very, very tough time for India and people and those who are getting affected by COVID. Really tough time.
And when you have high demand and low supply, often scammers fill the void. And boy, the article lists all manner of scams and price gouging. So just to give people a sense of some of the schemes that were uncovered, how were people being taken advantage of?
So what was happening was that lots of people, those who were doing the cybercrime, those who were doing the online fraud, so they suddenly realized that here is a big opportunity for them. And then they started advertising that, okay, they can provide hospital bed, they can provide oxygen cylinder, they can provide oxygen concentrators, they can provide the Remdesivir injection, they can provide the FebiFlu tablets, etc. And they started advertising their number that, okay, you please contact us, we will provide you. And innocent people, innocent family members, to save their mother, their father, their brother, their sister, their relatives, their friend, they were paying them online to get this stuff. And ultimately, it turns out that all these people are fraud. Most of them were fraud people. So most of them were doing it online. There were some people, those who were doing it physically also, that they will call you somewhere and they will give you a fake injection. So in that small injection, instead of Remdesivir, it will be having a glucose water. Or instead of having a FebiFlu tablet, it will be having something else tablet, but the wrapper will be the same. Or on the package, the label will be the same. And then they will sell to those innocent people. At times, they sold empty oxygen cylinder also. That, okay, oh, here is the oxygen cylinder, you take it and you give us 10,000 rupees or 15,000 rupees, and then you take it away. All kind of new techniques, all kind of new scam took place at that period. And that was very shameful. That was very hurting to the people.
Yeah, I'm just looking at the article. You've got, you know, people that try to sell regular empty fire extinguisher containers as oxygen containers. They're not fit to carry oxygen at all. People selling used funeral shrouds as new funeral shrouds, and you know, going to the top bidder. You know, I think maybe a couple weeks ago, we spoke to someone also in India, the very same topic, and when I was checking her Twitter account, I saw that she had been appealing for Remdesivir. Actually, she was thanking people for getting her the Remdesivir that she needed for her own mother, but then asking for Remdesivir for others on Twitter. And that's also a big issue. Remdesivir is hard to come by, and people are price gouging.
So when people saw this opportunity, many people indulged in this, that they will advise that they are sick or their family member is sick and they need the plasma, the blood plasma. And then they will secure their blood plasma and they will sell it in the black market to some other patient. Similarly, Remdesivir. So all these kind of new techniques, all these kind of the new ways, some online, some physical, all kinds of scams took place. I mean, this guy who was selling this cylinder, so he immediately jumped the price of the cylinder 3 times, and he was not doing the oxygen cylinder; he was selling the fire extinguisher. So old fire extinguisher he will take, he will do some fixing, and then he will sell it as an oxygen cylinder. And the poor family member, they will not realizing that this is not the oxygen cylinder. It may explode, it may burst because of the high pressure of the oxygen, if you get filled oxygen in this. So new techniques, all kinds of techniques were used to fool the people, to scam the people.
Yeah, not only are they selling things that are fake, but they're selling it at a top price. I will say that going through the article, pretty much almost everyone was, had to face the letter of the law for that behavior. That's how we know about these scams. And just sort of quickly before you go, you've talked to the victims of some of these scam artists. It must be just so heartbreaking. They're doing everything they can to keep their loved ones alive, and then to know that someone is taking advantage of that it's got to be so sort of destructive to their mental health.
Everybody said that this is a kind of moral crisis situation. Even if this situation, people are trying to make money by fooling the people instead of helping them, and they are making money out of it, and that too illegally and in a black market situation. So this is the moral crisis to the people. And the victims said, my God, where the Indian society has come to, that even in this situation, people are trying to cheat people. So this is a very big moral crisis to the Indian society. What happened to the moral of the people? What happened to their character? What happened to their national feeling? What happened to their feeling that they need to help in this situation? They need to help people. There are so many people, those who are helping others. It's not that everybody was scamming, but this scamming was taking place in the India's big urban areas like Delhi and Bombay and other big cities. It was so rampant. It was so rampant at that. It was very sickening to read. It was very sickening to talk to those people. It was very sickening to know the details that how they were doing it. I mean, even we, the journalists, we felt very, very, very strongly that, oh my God, what's happening to the people? Why they are indulging in all these things? Instead of helping people, you are cheating them in this situation when they are losing their family members and their mothers and sisters and brothers, etc. So it was very heartbreaking situation.
So, Hari, I just want to reinforce something that you said there sort of quickly in the middle of everything else, is that, yes, this is what we're sort of talking about now, but there were an awful lot of people who went in the other direction, who organized communities to help people, who got on Facebook and Instagram and started gathering resources. So many people have risen to the challenge of COVID-19 in India. Some people have not, and that's what we're talking about today. But Hari, Kumar, stay healthy, and thank you so much for joining us.
Thank you very much.